The creation of a First Nations authority is an important part of the governance agreement. This new body would take over the roles and the responsibilities of Health Canada's regional office in British Columbia with respect to First Nations. It will not take away the activities from communities already delivering health services. The new health authority will draw from the experiences and will support the health plans of individual First Nations communities. Health Canada will continue to fund health programs, but First Nations in British Columbia will decide which programs meets their needs. This agreement should allow a smooth transfer of resources. The new health authority will have the capacity to provide the quality health services while continuing to support the current community programs. The British Columbia First Nations already have a management and professional leaderships to make this a success. And the First Nations health systems will operate in partnership with the provincial health systems. Aboriginal communities get better results when they make their own decisions. I come from a remote community of Joe Haven on King William Island, northern community. The closest hospital from my community is 500 miles away and only accessible by air. Incredible change has taken place in my home territory, Nunavut, since its creation in 1999. I had the privilege of serving as its health minister when we assumed the responsibility for the healthcare needs of our people. Now in my current role as a federal health minister, I feel fortunate to be taking this journey with you. My experience in the North has taught me that assuming the governance of healthcare may be daunting, but it's rewarding in the long run. This is a major step for improving health services for Aboriginal people by Aboriginal people. The management of H1N1 for British Columbia First Nations demonstrates how new approaches to managing healthcare are improving outcomes. You will hear more about that later today. What's happening here in British Columbia is innovative and could prove to be groundbreaking for the whole country. First Nations leaderships in British Columbia have demonstrated vision, courage, and commitment throughout this process. I am committed to working in partnership with British Columbia First Nations and with the government of British Columbia to reach an agreement. When we first signed the BC Tripartite First Nations Health Plan in 2007, we all agreed that we would work together to develop a new model for a new First Nations Health Authority within 3 years. Through our mutual commitment and partnership, I am confident that it will be achieved. I would like to thank you all for giving me the opportunity to share my thoughts with you. I hope everyone leaves here with a better understanding of what lies ahead and how it will lead to better healthcare outcomes for British Columbia First Nations people. Thank you.